Los Angeles County. Next slide, please. So as the COVID-19 pandemic impacted medical care access, including HIV care, which we'll refer to as medical outpatient. Locally, Ryan White program clinics serve about 1 in 3 people living with HIV. To promote service continuity for people living with HIV during the pandemic and the stay-at-home order, phone and video telehealth was authorized for contracted providers as of March 1st, 2020 for medical outpatient. Telehealth was also added to the data system providers use to report services to the county. In-person medical outpatient visits continued throughout the year, although providers didn't have the same capacity. We will describe medical outpatient usage during the pandemic and which patients did and did not use telehealth services. Next slide, please. So patients received care at 43 clinics across the county, operated by 19 providers contracted under Ryan White. We don't know how many clinics were able to immediately offer telehealth services or what patient interest was, but in March 2020, 21 clinics did provide telehealth services to patients. And by October 2020, 39 clinics had served patients via telehealth. Patients could receive telehealth services at 91% of the clinics, which represents a good amount of access to medical outpatient services. Next slide, please. For this study, we considered patients of Ryan White funded clinics who had at least one medical outpatient visit during COVID. The COVID period in the analyses is March through October. The data source is the local Ryan White reporting system, which was modified, as I mentioned, to report telehealth services. The impact of the pandemic was unpredictable, so I'll summarize the study population's sociodemographics and medical outpatient usage, then show the results of a comparison of telehealth patients to non-telehealth patients, and then we'll look at the results of a regression model. Next slide, please. So there were 13,467 patients during COVID, and 6,894 of them used telehealth at least once, which is 51% of all patients. You can look at telehealth here as a subset of the total patients. It's not meant to be a comparison. Of all patients, you can see that 85% are male, 56% Latinx, 23% Black, over half are between 40 and 59 years old, and 69% are over 40 years old. 8% are experiencing homelessness, 1/3 are primarily Spanish speaking, 15% have ever been incarcerated, 63% live at or below the federal poverty level, and 38% are uninsured. The county defined service planning areas or SPAs for administrative purposes, and there are 8 of them. Over 1/4 of patients live in the Metro SPA. Metro, South, and San Fernando are the 3 with the largest shares of patient residents, representing almost 60%. Telehealth users look similar, although slightly larger shares are female, Black, older than 40, and a larger share live at or below the federal poverty level and are uninsured. Next slide, please. So here we have a map of the county. The red lines are freeways, and yellow, orange, and dark orange or brown areas are divided by gray lines are the 8 service planning areas, the SPAs. The map shows the percentages of telehealth use for each SPA. The color represents the percentage of patients who used telehealth relative to all patients living within the SPA. And we do see variation. I'm just going to highlight the SPAs with highest and lowest telehealth use. The 3 lightest colored areas are the SPAs where the most patients use telehealth as a percentage. In the northernmost SPA, which is Antelope Valley, 64% use telehealth. 62% of patients use telehealth in the San Gabriel SPA to the east and the South SPA. Usage was lower in the San Fernando SPA, which is the large dark colored SPA that extends to the north, and 42% of patients there use telehealth. And lowest in the dark area is the West SPA at 35%. We wouldn't attribute telehealth use to the geography. Since there's no burden of transportation to telehealth, these differences could be due to awareness of telehealth services or individual risk assessment regarding participating in in-person activities during the pandemic. Next slide, please. Now we're going to look at frequencies of patients who accessed care in February and the first months of the pandemic. For ease of viewing, August through October are not shown here. In orange, we see how many used telehealth in the month, and the percentage who were telehealth users is in orange text. Regarding total patients by month, there was an increase of almost 300 from February to March. Then patients dropped for 2 months and rebounded in June and July. During the decrease, a growing share of patients were using telehealth. The percentage of telehealth patients was highest in May at over half. Across several key populations, there's consistency in the direction of change month to month. Black patients had the highest percentage of telehealth users in a month, which was 60% in April. And after that peak, over half continued using telehealth for another month. Regarding total patients, if August through October were here, you would see a drop in patients again, and fluctuation is expected. Next slide, please. We see the same in these key populations also. Total patients 60 and older did not drop below the February pre-COVID count in the 5 months of the pandemic. They also maintained a high percentage of telehealth users. Telehealth use was lowest among patients experiencing homelessness in each month. In May and June, nearly half of ever incarcerated patients used telehealth services. Next slide, please. The results of the chi-square analyses comparing telehealth users to non-users in the COVID period show that the two groups differ by gender, race, age group, housing status, language, income, insurance, and SPA, but they were not significantly different by whether patients had ever been incarcerated. The logistic regression model included gender, age group, and housing status. The results suggest that females are more likely to use telehealth than males. Patients 40 to 59 years old and patients 60 and older are more likely than the youngest patients to use telehealth, and patients experiencing homelessness and institutionalized patients are less likely to use it than patients with permanent housing. The strongest effect is in the oldest group of patients, 60 and older. We recognize there are limitations to this analysis. We have an understanding of how many people and which used telehealth services, but not what restraints may exist in clinic capacity or what amount of interest and awareness there is among patients. And we didn't consider how many telehealth services patients accessed. Next slide, please. So the expansion of telehealth services helped maintain access to HIV care services during COVID-19. Remember, just over half used telehealth at least once in the observation period. Patients who are less likely to reap the benefits of telehealth are young and not permanently housed. And we also saw that as a percentage of patient residents, fewer in the West SPA used telehealth. Additional outreach and resources are needed to promote telehealth during COVID-19 to maintain HIV care access for all in order to continue progress towards ending the HIV epidemic in Los Angeles County. Next slide, please. So I want to thank you all for joining me, and I also want to thank Ryan White service recipients as well as the Ryan White clinics. Also, big thanks to my bosses and colleague, Wendy Garland, Sona Aksuzian, and Janet Kwanis. And next slide. And this is my contact information. I welcome any emails with questions or ideas that you may have. Thank you very much.
Thank you, Angela. Look forward to hearing additional questions that other folks have. I just want to jump in first and ask, if you had a hypothesis going in, I think I find myself a little bit surprised by your findings, except for maybe the part about older people, but I'm curious if you had a hypothesis and were you surprised, or was this what you expected in terms of the differences?
You know, I didn't know. Yes, the older people, I guess it was a surprise. I didn't necessarily think that they would be using telehealth more than our youngest patients. But, you know, I don't know that we can keep saying, people 60 and older are less comfortable with technology or any of that. And I think maybe part of what drove their telehealth use was just their commitment to their care.
And what about some of the other findings? Were they consistent with what you expected?
Yeah, I mean, I definitely was going and not having a lot of ideas about what would happen. I personally, hold myself up when the pandemic started, and, I don't know what other people did, right? It was a wide variety. So, there's literature about telehealth use, of course, but how much did we really know about telehealth use during a pandemic? So, right, a lot did change. So, no, I was pretty open-minded.
There's a great policy question here, which is, are there discussions about telehealth being a long-term option for those that we serve in Ryan White clinics?
Yeah, I mean, I think we'll have to see. It's going to be a matter of, what is the burden versus the benefit. Here, we're not looking at medical outcomes, right? And I'm sure clinics are thinking about that. So, yeah, I mean, it would be great, right? I mean, people set up the infrastructure to do it. There is use of it. And there would be patients who would prefer it, patients who would, find it easier than the travel, of course. So yeah, we'll have to see.
One more question. Gabriel Edwards asks, are younger people less likely to use telehealth because they're less likely to use any kind of health services?
That's a good question. Let's see, scour my notes. I definitely be happy to get back to you with more information. But we've got, all sorts of data, and I don't know that we would say they're unlikely to be doing that.
Angela,
yeah.
I have a follow-up question that might help to fine-tune this. So I noticed the reference group is in-person visits. So it's actually a comparison of odds of telehealth versus in-person. Is that the correct interpretation?
Right.
Okay, so it doesn't necessarily mean that it's telehealth versus disengagement from care.
Correct.
Okay.
It's just
I just wanted to point that out, and so maybe you can speak to that like nuanced or that different interpretation versus like saying that they're disengaged if they're not into telehealth, which might not necessarily be true.
Right. Okay, let me pull this up. I can.
I'm not trying to gotcha. I'm trying to be optimistic.
I know.
Yeah.
You've got like files and papers everywhere. Definitely come prepared to a conference in a different way when it's virtual.
Yeah, I was thinking, so like I noticed, for example, the West SPA Service Center, for example, they were less likely to use telehealth, but it just might mean that they had an easier time doing in-person services or just preferred in-person services.
Right.
I mean, that could be a way to, I'm wondering if that could be a way to interpret it.
Yeah, there's so many variables that we really, we're not getting information on. We didn't talk to the patients, we didn't talk to the clinics. We do have a lot of data coming in through our Ryan White reporting system.
Okay. So could a potential like next step be to like look at both of those in-person telehealth versus disengagement from care? I'm not sure. That would be a very complicated missing data analysis and stuff like that, but I was just wondering if that's like a possibility.
Oh yeah, we have tons of possibilities.
Okay.
And these were kind of our first steps. We've been starting to look at telehealth, of course, a month or two after the pandemic started, and kind of fine tuning, which pieces of information are really helpful for us in finding out who's using telehealth and who's not using care at all.
Okay, thank you.